Before we jump into this week's episode of the Major Pain Podcast, I will remind you that I am not a medical professional. Please do not take any medical action based off what you hear on this podcast without first consulting your doctor. Extra special thank you to our Patreon producers supporting this show at the highest tier of $25 per month: Steve Kavanaugh, Chris Fowler, Trish O'Brien, and Hipster Leia. Thank you for checking out the Major Pain Podcast. Let's get to today's episode.
Medicine itself is kind of nebulous.
My brain is just wired differently.
You're feeling symptoms that the tests aren't showing exist.
People need to hear your story.
Welcome to Major Pain. I'm your host, Jesse Mercury, and this week I'm so excited to be joined by Bonnie from Dream Big Wellness. Bonnie, welcome to the podcast.
Thank you, Jesse. I'm really happy to be here, and thank you for the invitation.
I'm thrilled to talk to you today, talking about a very important topic, the importance of mental health when you live with chronic illness and disability, something very personal to me and to you as well. Before we get into that, let's get to know you a little bit. So, Bonnie, why don't you tell us about yourself?
Sure. I am a licensed marriage and family therapist in Washington State and a nationally registered art therapist who's also board certified, which means I have completed graduate training in both of those things and do an integration of art therapy into my practice. And I am also president and founder of a nonprofit, a 501c3 nonprofit in Seattle that specializes in chronic pain, chronic illness, and cancer care. Yeah,
amazing. And what do you do for fun? Tell us about you as a person. You know, what are your hobbies and interests?
So many. I'm just thinking about that. Of course, art is a part of my interest. I love to travel. And more recently, in the last 3 years, I have gotten into doing a lot of mental health trainings and retreats, and international retreats as well. So I've done about 15 retreats in the last 4 years of training clinicians. That's been a real fun adventure and a great way to meet a lot of people too. But I love the outdoors. You know, I'm a Pacific Northwest person and originally from Montana. I love doing anything that involves outdoors and the water and being in the mountains. Mm-hmm.
Awesome. Yeah. I mean, we are both in Seattle, and actually that's part of how this podcast came to be today. And we'll get to the personal connection in a minute, but I'm really excited to introduce our listeners to Dream Big Wellness. What is Dream Big Wellness?
So Dream Big Wellness is a 501c3 nonprofit based in Seattle, and we are dedicated to improving lives that are impacted by chronic illness, chronic pain, and cancer care. We're a group of art therapists and mental health professionals. We have 7 mental health clinicians on our team and 4 board members who have shaped and created this wonderful nonprofit to help increase access to art therapy services and mental health care to help people navigate the medical system and their experience of these incredibly difficult times in their lives.
So amazing the work that you're doing. And one of your partners in this, Katie, is actually my own personal therapist, which is sort of how this came about. Katie was the first therapist I ever talked to about chronic illness who had any idea what she was talking about. I mean, I went through a few therapists before I found Katie, and it was really a life-changing thing for me to be able to talk to somebody about chronic illness who understood the impact that it has on your life. And she started as my personal therapist, and then a big topic that kept coming up was how my illness was impacting my relationship. This was years ago, when I was, not working, applying to be on disability, and really just kind of stuck at home all day, every day. And it was really impacting my relationship with Andy. So we transitioned pretty quickly into Katie being a couples therapist for me and Andy. And we're married now. So great job, Katie. We still see her. And I also now have another personal therapist who has a chronic illness. So I'm so lucky. I'm so grateful for the incredible mental health support that I've had over the years. Katie is a huge part of that. And she co-founded Dream Big Wellness with you. And, I just found out about this organization, and I know from working with Katie how great of a therapist she is. And I took a look at this organization. It's just like, wow, this is really awesome. And I really want to share about it. So Katie and I discussed it and felt that me talking to you on the public platform would be the best fit, since Katie is my personal therapist. So I'm so excited to get into this more and learn more about what you do today. And I just want to say, right off the gate, how deeply important it is for anyone living with chronic illness or disability. It is so important to have therapy. And whoever you talk to, if it's not the right fit, keep looking until you find the right person. I learned the trick of, contacting different organizations and asking, who do you have on staff who deals with chronic illness and disability? Because that's the person I want to talk to. And the fact that you and Katie are putting this organization together with the rest of your partners to really address that is so important and so valuable. So I just want to say thank you up front. And let's get into it. What are the specifics about providing mental health care to people with chronic illness and disability that is specific to us, that you may not deal with other people who don't live with chronic illness and disability?
Yeah, absolutely. That's a really great question, Jesse. And I think some of the things that you just mentioned kind of came up in there about why is it important, and thank you again. I just want to say thank you for sharing your story as well and your experience with that. And that's why Katie and I kind of shaped the nonprofit together, is to be able to create an organization that supports chronic illness, that are a team of mental health therapists that support chronic illness, chronic pain, and cancer care for that community specifically. Katie was working in a pain clinic while I was working in a cancer institute. And then we kind of came together to create this organization because there's not a lot of, especially art therapists and people in the community that specialize in this area in particular. And we were noticing that as a gap of care when we were working in those places, of being able to try to create more organizations in the community that can support this. We are the only art therapy organization in Seattle that does specialize in this. And so why I think it is important in particular for to find a mental health clinician that knows about this field and what people might be experiencing is something that you mentioned there, is like navigating relationships, right? Like navigating changes in relationships, navigating communication. Communication dynamics change when you might be experiencing chronic illness and fatigue, or also how do I continue to communicate things to my loved ones without like hurting them or having an interaction, and sometimes I think that's what's also helpful about having a mental health therapist, is that for a lot of my clients and what I witness the experience is that they're able to share whatever dark moments or dark days that they are having with knowing it doesn't impact anyone on the other side of the screen or impact anyone else on the other conversation. And I think that sometimes we might want to hold back what we say to our loved ones just because we don't want that impact, or like to impact them emotionally from what maybe I had a dark dream or an area of, fear of like death, dying, chronic illness, or frustration or anger, any of the emotions that are coming out that I want to be able to express or need to express, but I can't express those with my loved ones, not out of like that I can't, but maybe that I want to protect them from my emotions as well. And so having a place where, can fully be yourself and not worry about, hurting. I had someone tell me the other day, I don't have to worry about hurting you. And I was like, yeah, that's the benefit of having a therapist, is that, you can say whatever you want. And this is that space.
That's so important. And I relate to that so much, especially, thinking back on my journey before I had a diagnosis, when I was declining. Talking about declining to my partner was very, very difficult, because it's not just about me, it's about her too. And it's about how it impacts her if my body stops working. And all these discussions about, do I need to move home to be with my parents to have care? Does that mean that we can't be together anymore? That hurts her. These conversations hurt her directly. So yes, absolutely, having a safe place to talk about those things with someone who understands, who has experience dealing with other people with chronic illness and disability and understands the specificity of that experience is so powerful and so important. Tell me about art therapy. I think there's going to be people out there who aren't familiar with art therapy in general. What is art therapy?
Oh yeah, well, I'd love to talk about. Yes, I'm happy to talk about art therapy. And as you were just I just want to mention really quickly. You mentioned like medical decision making, all the different
Mm.
decisions that come up with that. That's also where a therapist can be really helpful. So,
Yeah. Yeah,
being
absolutely.
able
Oh,
to,
that's huge.
yeah, being able to run these ideas and thoughts by someone, or being able to process it out loud, before we're kind of processing it with our loved ones or just navigating the decision. There's so many decisions that come up that we can also experience decision fatigue. And so I think that that can also be a helpful resource. And that ties into art therapy. So art therapy can also be a tool that is used for decision making or communicating and processing what our emotions are in a nonverbal way. What I notice with people maybe experiencing chronic pain and chronic illness or cancer care is that we've had to share our story so many times verbally.
Yes. Oh my God. Yes. Sorry. Sorry to interrupt, but yeah, oh my God. Every time you see a new doctor, you got to start from scratch and it's
Yeah,
exhausting.
it's
Sometimes I
so
feel
exhausting.
guilty on this podcast asking people to tell their story again because
Yeah.
I know how sick of it we get. But I hope that in this scenario, it's like I'm actually someone who wants to hear it versus a doctor who's just like, I need to get to my next patient. And that's part of the trauma is like telling your story over and over to someone who's not necessarily listening to you. But yes, that's huge. Absolutely.
Yeah, yeah, and that also you mentioned like that can kind of feel like reliving your trauma, like a medical
Mhm.
trauma or medical experience every time you're sharing your story.
Yes. Oh my
You
God.
know?
Absolutely.
So being able to share that in a way that's nonverbal processing or processing it through imagery might be another tool of saying like, this is how I'm feeling. Sometimes even clients that I'm working with will take an image into their medical team and be like, this is how I feel.
Mm.
Or I used to have a bunch of magazine images and I have a card deck of images that people can flip through and say, this is what resonates with how I feel. And I don't have words to maybe describe that experience, but that image describes what my experience is.
Wow.
Um, and that can be sometimes more powerful. Sometimes what we're doing when we're sharing our story and we're trying to find emotion words to describe our experience is that we're sending it through a verbal filter first and like kind of trying to find this language for it. But our experience is actually stored in images and in different, maybe traumatic images as well in our brains. And so if we can process the image that we're having and find an image that resonates with that, then it helps get to things a little bit faster. It also might, if you're working with the subconscious. So also knowing that there might be some certain images or certain things that come out in front of you that you weren't anticipating or expecting. And that is a way of having a new experience or new perspective of your imagery. But there's all different kinds of benefits of using art therapy from, you know, improving neural cognition, neural pathways, to emotional expression and identification, to communication. We're drawing pictures of different communication dynamics sometimes. And I always say stick figures, stars, lines, shapes, colors are just welcome. You don't have to have any experience to do art therapy. Yeah.
So cool. You're making me think back to an episode we did a while back with an artist named Kiriana, who paints chronic illness, and she does self-portraits, and she also works with clients where she discusses like what are your symptoms and then visualizes it on a portrait of their body. It's really powerful. And she talked about people taking it into their doctors to say, this is what I'm experiencing. Because how do you translate pain to words? It's so difficult. It's something that I've struggled with for years, and I think was a big part of why it took so long to get diagnosed. Well, there's so many reasons, but I do think that towards the end of the diagnostic odyssey, I did start to think about, I'm falling into patterns with how I describe my illness, and maybe it's not triggering something with the doctor because I'm using the wrong words. And is there another version of describing this that I can come up with to try to trigger something in the doctor's brain? If I use the same thing every time and I'm not making any progress, is it me? Am I the problem? And I don't know. I mean, I'd like to blame so many other things. But who knows? Maybe that was a piece of the problem. So yeah, having this visual component, and you just said something that I've never heard in 5 years of doing this show, of taking in images to your doctor, finding images in a magazine, taking them to your doctor to say, this is what I'm feeling. I mean, I've never heard that. That's a great tip. Another really cool idea that I've just never considered before.
Yeah, something else that I, do, or it might be even a image of a body scan too, an outline of your body scan about where is your pain and what is that pain feeling like. If you could describe that in a line, shape, or color, what would that look like?
Wow.
And then the story too, I do a story timeline of your medical story. Sometimes creating a visual timeline of that helps cue your brain about what to say when, and you don't have to hang on to that or memorize all of that information. I know some people have a spreadsheet or all different systems of medical tracking, but if we can do like a medical timeline, of a visual timeline, then you can hand that into your medical team as well and say, this is kind of the timeline that this experience happened. And you're processing it as well with that image of being like, what did that time mean to you? What did that look like to you? Now, I don't recommend processing your artwork with your medical teams. I recommend processing that with your therapist if your artwork, but your artwork can provide a visual image to help get your message across.
Yeah.
And I think what you described too is some common experiences of, I feel like I'm saying what my experience is, but am I using the wrong words, right? Then you start thinking about like, is this me?
Yeah.
Happening that, and that can also be where meeting with a mental health clinician or art therapist can be very helpful, is because it can feel so invalidating in your experience, especially if you're living with like an unidentified medical condition or not like quite sure what's going on yet, and you're in that process of trying to figure it out. It's not diagnosed yet, and you feel like maybe you're describing something that is wrong. So trying to figure out, I'm having these experiences where I don't feel very validated, but I'm having this pain and I'm not sure, how to be able to communicate this.
Yeah,
So
totally.
working with your therapist about how can I communicate this? Yeah.
Yeah. It's so interesting thinking about using creativity and artwork as another tool to express what's happening inside of you, especially if you don't understand what's happening inside of you, like I didn't for so long. But I think with any chronic illness or disability, or with cancer care, even if you have a diagnosis, you're still going through a medical process internally that is unfamiliar. And, even if you know what it is, like let's say you were just diagnosed with lupus and all of a sudden you're having all these symptoms and your body is changing. You know it's lupus, but you still don't understand these sensations your body is giving you. We are a mind and a body, and that connection is so important. And when your body starts giving you information that you're unfamiliar with, it is destabilizing to your core. And it doesn't matter if you know the words to put to it or not, it's still destabilizing. For me, having the words to put to it after decades of living with it completely recontextualized everything and allowed me to understand it on such a deeper level. And I think it's so important for people to have a diagnosis. But I was on the journey of listening to my body and trying to understand what it was telling me for so long already that the sensations are familiar now. I understand them. But if I had ever stopped to try to paint them, who knows what would have come out? I have no idea. That never came up. It's such a cool idea. Who knows what my subconscious would tell me? Because that's your body communicating with you through your creativity. And I think that creativity is one of those places that sort of intermeshes between our mind and our body in a way that we don't necessarily understand. So I think that's such a cool, powerful vector of exploration into your own body.
Yeah, absolutely. I mean, when we think about pain, trauma, sadness, loss, grief, a lot of art comes out of those experiences in life, a lot of music, plays, theater, right? Like writing and art and creativity comes from those places. And so if we're able to express that too, what does that do for us? And maybe that there's also this beautiful kind of code that happens with art is it can be a safe place. There's a safe, confidential space, right? Like maybe if you did that painting of your pain, what that represents to you, but everybody else doesn't have to, right? And that's where you can kind of get your story and your expression out, but other people may not comment on it or, say the way that they would in a conversation when you're talking about your pain. And so you're still able to have this representation of what your pain is, without having it to be your entire story shared, in that way. So
Yeah, that's really interesting. Wow. I want to talk more about Dream Big Wellness, but I want to take a detour for a second and hear about what brought you to mental health care. What made you want to enter into this line of work?
yeah, that's such a great question. It kind of, sorry, you saw me kind of like probably laugh a little bit because it's been such a journey. I will say, yeah, I'm just going to be really transparent and share this story that I definitely knew I wanted to be an art therapist. I had my undergrad in psychology and a minor in art. And I knew a little bit about the profession of art therapy, but I never wanted to go to graduate school. So I actually spent 10 years of trying to avoid becoming an art therapist in particular. And I did a lot of nonprofit youth and family service work. I've been in nonprofit for 22 years. And worked with different youth, family, mental health agencies, really enjoyed that work. I've really enjoyed the organizations that I've worked for, but it was never quite the fit. And I'd always get to a certain spot where I wanted to help guide people further or really help ease the pain and not like be the one making the referral to the person that uses the pain. I wanted to be able to support them in that way. And it was kind of a way of avoiding your calling, I guess, in a way. Or suddenly, you know that this is what you're meant to do. And it was a profession that I wanted to work in, but then I finally just made the commitment to go to graduate school, which was 4 years. So to become an art therapist and mental health counselor, it's 3 to 4 years of graduate school to have that dual graduate degree. And then you have about 2 to 2.5 years of postgraduate training after that. So about 6 years to get here. So of training. And now I'm 8 years into the field, but definitely was a big commitment that I feel like I knew I wanted to do. And then I started working in hospitals, inpatient medical centers, so inpatient hospital in Seattle. And I did outpatient work in Seattle. And that's where I really fell in love with the work and knew that this could be something that impacts people's lives in a positive way that are going through one of the darkest times in their lives.
Yeah. And what drove you to specialize in this specific area of people going through challenges with their health?
Definitely my internship. I started working at UW Medical Center and then moved over to Swedish Cancer Institute. And it's all about the clients. The patients changed my complete trajectory. I used to work with kids prior to this, and now I work with all adults. So that's a common assumption too, is that art therapists work with children when I actually work with all adults. Knowing that art therapy, seeing and witnessing the way that having a media be able to access people's emotions and give a story, what you're doing here, Jesse, is a part of like giving patient voice and people's voices to a story and letting them feel less alone in their experience, generating that community, a space for people to be heard. It was so valuable. And it's I think early on I experienced, I'm like holding my art because I feel the gift of being able to enter that space with people. It's a gift that they invite me. I kind of think of it like it's a mutual invitation. I'm inviting you into a space that's safe, kind, and non-judgmental. And they're inviting me into their lives and during a vulnerable time. And it's definitely a space that I hold with a lot of care and a lot of love.
Wow, that's so cool. Thank you for the kind words. And I think it's an interesting dichotomy because with a chronic illness, you really want to talk to someone about it, but people often don't want to engage with you. That thing is so common where you start talking about what's happening with your body or the pain that you're in, and their eyes glaze over and you just see their discomfort. And it's just like, oh, why are we talking about this? We're like, this is not a conversation for polite society. And it drives me absolutely crazy because when you're living through it, it's a huge part of your daily experience. And we all need to express ourselves. And it is vital to talk about that with somebody. And for some reason, our society is socialized against doing that. And I don't understand it. It frustrates me. So yeah, so this podcast to me, it's like such a, cathartic conversation every week to talk to someone about that. And then people invite us in ways that is really shocking to me. I mean, it's part of what I think makes this show so compelling is that we are talking about very intimate things with every guest. And it's a safe place to do that. And it's a place where not only is it an inviting environment, but there is a whole community around it. And it's this thing that society tells us not to talk about. So yeah, I mean, there's so much power in that, and I still feel it every single time.
Well, and I think, when you're with society feeling that pressure to not talk about this can feel very isolating and very lonely. And so, and feeling like, well, maybe I'm the only person having this medical experience or living like this. And so creating this platform is such an important piece, and art therapy, all these different community resources that we have to be able to know that you're not alone in this experience is so important. So
yeah,
I really thank you for that and creating this resource for people. So
well, thank you. And I thank you for creating the resource that you're creating for people. That feeling of isolation is one of, I think, the most common feelings of living through challenges with your body, where it's like suddenly you are alone, not just in your body, but in your diagnosis. You're the only one oftentimes living with this thing. I remember the first time I met someone else who had severe reactions to mold, and I was like, wow, I've never met another person who has that. I've been the only person my whole life, and people don't believe me all the time. And it's this invisible thing that I am battling that no one else can see. And I am like collapsing on the floor and twitching, and people are like, that guy's crazy, And then here's another person who's gone through the experience, and suddenly I feel so much more validated in my own experience. It's so powerful. So yeah, that is a very common experience, I believe. When people come to you for mental health care around chronic illness and disability, what are the other common experiences that people going through health challenges are having?
Something that you kind of just spoke to that isolating feeling, being alone, but also that means loss and grief. There's a lot of loss around these experiences, the loss of physical mobility, physical limitations, the way that I used to be able to move in the world, loss of way that I'm able to interact with other people, maybe interacting with other people in general. Even if I do get to interact with people socially, it feels different now because no one's wanting to talk about my experience, or how do I talk about my experience when I'm here with you, but I'm experiencing pain in my body, so really, I think a lot of that comes with this illness is also loss, and how we're working, with the grief around that. And then there's the experiences of depression, PTSD, anxiety around the illness, lots of medical anxiety is what I see. But definitely I think where, the heart space that I enter with a lot of people is around how has it impacted your life and the amount of losses that you experience. And it can just be multiple losses. Maybe it's even medical teams, right? Like different medical doctors or physician providers, or, maybe I had to move for medical care and the loss of different support systems that I had around me, the loss of being able to open the refrigerator the way that I want to, or, being able just to stand up or be able to do the things that I want to in my body, being able to, use my coping skills, which might be getting outside, going for a walk. I can't do that anymore the way that I used to. And so what are my coping skills now? What do I do, to help manage my emotions or my experiences when I'm so physically limited and can't do the things that I normally would? That's when we're coming up with a new toolkit.
Yeah, I've experienced every single one of the things that you just talked about. What do you say to someone who's, let's take mobility as an example. You just mentioned, I can't go out for a walk the way I used to. This is something I lived through. What do you say to someone who's going through that? How do you help guide them in that moment?
I think being there with them, identifying that, right? Is that something that's that you're experiencing versus that is as a loss, as a grief, and validating that that is a huge grief experience that you're going through, I think is the first thing. And then it's kind of like, is there something else that can provide us some sense of relief? And that might be mindfulness practices, meditations. I like, us with therapists, we have like a mental drawer. I like to call a mental drawer of psychotherapy tools. And I have a mental drawer, file drawer of art therapy tools. And then I'm kind of integrating those two as well. So I might use things such as, EMDR combined with art therapy, or IFS and art therapy. IFS is another theoretical psychotherapy approach. And so looking at how can we kind of help people move through a series of different options and tools that work best for them and their bodies. But yeah, I think having someone be there with you in that experience who knows and understands it is really important.
Yeah, very interesting. Yeah. I mean, I've talked a lot about on this show about my use of a wheelchair, where I, was having mobility challenges, and I finally, out of desperation, made the decision to try using a wheelchair, and it opened my life back up to me. And it really showed me that a lot of the societal pressures that we feel around mobility are false and counterproductive, and that if something changes in your life due to a chronic illness, something new is always around the corner. And, this way for me of movement that was lost to me was replaced by one that I'd never tried and ended up loving. And instead of going for a walk, I'd go for a roll. And, I've never been someone who really I've never liked walking all that much. It's kind of weird to say, but I like to bike ride. I like to jog. I was never really someone who would just go for a walk. I had my dog Miles for 17 years, and I'd take him walking, multiple times a day. But I wasn't someone who'd just be like, it's nice outside, I'm going to go for a walk. That wasn't the thing I'd choose. But in the wheelchair, going for a roll was absolutely one of the top highlights of my day, because suddenly I'm outside, I'm under my own power, I'm in the sunshine, I'm in the fresh air, and I feel better. And it really changed my perspective on life. Like, just that simple joy in movement showed me what I'd been taking for granted my whole life. And then I got a diagnosis and I got my mobility back. And now I'm someone who really enjoys going for walks. Just one of those other strange little things that has changed in my life, a thing that you couldn't really anticipate. And that knowledge that no matter what you lose, there is something you haven't tried that can be gained. And I know that it's very difficult to feel that in the moment of loss. And of course we have to grieve. And that's the first step that you mentioned. We have to grieve. But this is another thing that's completely changed my perspective on life, is that, I used to feel like if I couldn't do the things that I dreamed about doing, my life would be unfulfilling. And I've since learned that there's a bunch of other things I've never considered that I'm going to get into that are going to make my life fulfilling, and maybe even preferable to the things I dreamed about before.
Yes, right. You experience that transformation process. Yeah, and the perspective shift of there's other things that I haven't thought about that I enjoy now, or ways that I want to live my life. And I think that's also what I just deeply love about my job, is that I get to be a part of people's experience of thinking about, what do I value in life? Reevaluating their life. What do I value? How do I want to live my days and spend my time, given the limitations and the physical illness that I am experiencing? So even though I am experiencing this illness, how do I want to spend my time? Is there something else that I can do that helps me through this experience?
Yeah. One of the other losses you mentioned is one I hear about a lot and also experienced, is that loss of friends. When you feel like you can't talk to your friends, you feel this sort of like silent judgment or fear around engaging with you when you're going through pain, and friendships fall away. And I hear this over and over. Can you speak to that? Like, what is happening there? And what do we do about it? It's such a hard question. I'm sorry.
Why is it happening? I don't know. But, I think that that's such a common experience, is that friendships change and relationships change through this experience. And some of it might be, you spoke a little bit to the society not wanting to talk about this, right? Not wanting to talk about illness sometimes. And it might be people's own experiences of loss and grief and how we have not done very well, I think, as like a Western culture to be able to talk about experiences of loss and grief and other people who, or our fears or our emotions in general. And so that might, there might be some discomfort associated with that, right? And there also might be just this experience of, I need to be around people who get it or who understand it more than what my previous social group maybe did. Yeah. Yeah.
Yeah,
Tell me a
that's
little bit more about your experience of that. Yeah.
that's a really good point. And I one of my favorite quotes of all time from this podcast was Amy Stephanie Perez saying, "Chronic illness is a crappy person detector." Where if you're going through something and someone can't engage with you on it, maybe you aren't that close. And this can be really hard, you know?
Mhm.
And then the other side of it is something that I have spent a lot of time thinking about is what am I communicating? And I think that oftentimes we expect people to see and feel and know our pain. But if we're not telling them about it, they might not. They might have no idea. Chronic illness, chronic pain is invisible. It's an invisible illness. And we talk about this a lot. So
Yep.
I've learned since then how important it is to be open with your friends, your family, your loved ones about what you're experiencing. Because, the classic example for me is my partner would touch me and I would recoil in pain because I had undiagnosed small fiber neuropathy. And
Yeah.
just that like physical touch was really painful. And
Yeah.
when she touches me and I recoil in pain, what is her experience of that? I'm focused on my experience. Ouch, that hurt. But her experience is the person I love is recoiling from me in horror, and
Yeah.
that needs to be talked about on both sides. So these things can be two-sided in ways that we can't see when we're in the midst of dealing with the health implications of whatever it is that we're dealing with.
Yes, yeah, exactly. And that's so valuable to have those people that will have that communication and connection with and saying, like, what is your experience and what is my experience? How is chronic pain kind of impacting us? I sometimes talk about it like the unwanted house guest that moved into the house that we like unwanted roommate or something that came in that is impacting our lives and we can't really get rid of. So how do we want to live with this or communicate around it and create specific boundaries around it?
Yeah,
Yeah.
that's perfect. I love that.
Yeah.
What are the benefits of therapy? And maybe let's take this separately of therapy in general and then art therapy specifically.
Yeah. Benefits of therapy for people with chronic illness, chronic pain,
Yes.
and cancer care.
Yeah.
I mean, so many. I think one of it that we've talked a little bit about is having that space to be heard, to experience that, like people who are trained in loss and grief, and a space where it's a safe place to be, however you need to be, and expressing whatever kind of dark images or feelings or pain is coming up for you, and navigating different communications, help with decision making. I think also navigating support, having support for not only are you navigating pain, you're navigating systems, right? And
Mm.
financial impacts
Mm.
and sometimes broken health systems, healthcare
Yes.
systems, and and that frustration and fatigue and just the sheer exhaustion that can come with that too. Therapy can be very helpful for that. So this is kind of all of the some emotional benefits that I'm speaking to, but there's also a whole, neuroscience behind this too, and ways that we can shift our thought patterns and different perspectives around it. Ways that mindfulness, meditation might increase our resiliency. I'm using that word as in ways that we want to be able to. It's hard because our window of tolerance gets squished so little when we're experiencing pain. And so how can working with a therapist can help build or expand that window of tolerance a little bit for people so they feel like they have more capacity for other experiences in their life. I want to actually, as I'm talking to you, I'm like, I want to kind of bring up on our website, on our page, we have on our website, we have medical illness and recovery and how art therapy in particular can a whole list of different ways that it can provide benefit for people.
Yeah, awesome. I'll definitely put a link to the website in the show notes for the episode. I think that there's probably a common feeling among people dealing with health challenges who might be interested in therapy or are not in therapy now. The idea of adding something to our plates can feel
Totally.
completely overwhelming.
Yeah.
What would you say to someone who's feeling that?
I'm so glad you asked that question because it's like you're telling me another medical provider when I just and like juggling the medical appointments can be so difficult and so challenging. It's just like feeling like I don't have time for another one, right? But working with a therapist can actually help you navigate that too, right? Like, is there a different way that we can help kind of navigate the overwhelm of managing your medical care, overwhelm of all of these appointments, and reduce the feelings of overwhelm and stress that you have in managing your medical care?
Yeah. So it
Yeah.
might seem it might seem counterintuitive to add another person to lighten the load, but that's what therapy is for. That's exactly what it's for.
Yeah, and some of the things that we talk about. So one art directive that I've done is many times, is people might be like, it feels like a ton of bricks on my shoulders, or it feels like I'm just weighted down by all of this medical care and having another thing and another thing, and I'm not getting anywhere, or what my experience is. So it's like, okay, well, let's draw all those bricks. Let's draw like what are the rocks, the big rocks that you're carrying around with you that it feels like, and maybe we can start taking one of those rocks or those bricks off one by one. Is there something that we can do to help lighten that load so you're not feeling so overwhelmed and weighted down by all of this experience? And if we can take one of those as an emotional rock, right? And people might even be experiencing more pain, physical pain, from the emotions that they're carrying around with them. And so sometimes we notice as we reduce some of the emotional distress, the physical pain can ease as well.
Yeah. I know for me, therapy has helped me to recognize why I'm feeling certain ways about certain things. And sometimes just that moment of connection can be enough to diffuse an anxiety or a bad feeling. It's also given me tools to process through what I'm feeling, tools to calm myself down, tools to deal with anxiety in the moment. And now that I'm sort of rebuilding my life with my newfound health, with my diagnosis, there's been a huge amount of stress and worry about relapse and not knowing what I can take on. And I'm sort of building this pyramid of a life, brick by brick. And I'm worried about the foundation because the foundation is built on my health. And that brings a lot of anxiety because I've spent so much time sick in my life. And on top of that, the anxiety of like, wow, I spent most of my 30s in bed and I'd really like to achieve something and add something to the world. And now's my time to do it. And all this internal pressure. And it's just a lot. There's a lot of voices going on in my head on top of just getting married. And Andy and I talking about building a family. So yeah, I'm addressing all of the personal stuff with my personal therapist and all of the relationship stuff with my couples therapist. And both are invaluable tools that have really enriched my life. And I just can't recommend it enough to anyone out there who is feeling lost, who is feeling stuck, who feels like they need help or support with their chronic illness, with their disability, with cancer care, with any sort of health challenge. Try therapy. Bonnie, is there anything that we haven't covered today that you'd like to address?
I don't know. I feel like I could continue the conversation because, as you say, one thing I just want to keep on wanting, like, yes, that's the experience, and yes, 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 and I think that this is just a really valuable experience and platform for people, and letting them know that they're not alone and that there are professionals out there that are skilled in these areas that really do want to help and have done a lot of work to try to research all the ways and tools that we can help through these experiences. So thank you, Justin.
Yeah, thank you so much. That's a cool way to think about it too, is like there are people out there who are studying how to help you.
Oh, for sure. Yeah.
So all you need to do is find the right person. And that's hard. I'm not saying it's easy, but it's doable. and it's worth it for sure. Where can people go to check out Dream Big Wellness and check out what you're doing?
Yeah, so people can visit our website, dreambigwellness.org. And I mentioned we're a 501(c) nonprofit. We have a page about chronic illness, chronic pain, and cancer care and the ways that therapy can help. I mentioned that. And then we also have 7 clinicians, and we have 3 clinicians right now that have availability. We accept most insurances. We also have a pay it forward program for people who might not have insurance coverage for their therapy sessions and need financial support for therapy services. So
awesome. Yeah. That's so cool. That's another important piece, is the financial piece. You know, if someone doesn't have insurance, that can add another layer of complication of finding therapy for sure. And what area do you serve? Is it Washington State?
Washington State, yeah. We serve all of Washington State right now. I do different retreats and different other services. Have done I volunteer I've done 8 cancer-related retreats as a psychotherapist, volunteer for those kind of nationally and internationally. But all of our individual clinical services are in Washington State, yeah.
Awesome. You may be the wrong person to ask this question, but if someone is listening to this podcast outside of Washington State and is looking for a therapist, what do we do? Where do we start?
Absolutely. I'm like, oh yeah, great question. Yeah, definitely. So arttherapy.org is the National Art Therapy Association. And there's a Find Art Therapist page. There's the ATCB, which is the Art Therapy Credentials Board, where you can just filter by state, and it will show you all of the art therapists in your state. There's also all of the search tools, of different associations, Marriage and Family Therapist Association, the APA, American Psychological Association. They all have Find a Therapist. And then there's, of course, Psychology Today, and entering all the filters that you can by filtering your insurance. You can search for chronic pain, different types of clinicians that have that specific specialization area. Yeah.
Turns out you're the exact right person to ask that question to. And that reminds me, Psychology Today, that's how I found my personal therapist. Yeah. Amazing. Bonnie, thank you so much for an incredible conversation, shining a light on something that is so important, something I'm really honored to be talking about on the show. Just a really deeply important topic to the community that this show is for. So thank you so much for doing such a wonderful job on the podcast today.
Thank you, Jesse. Thanks for having me. Really appreciate it.
Thanks for listening to this episode of Major Pain. I'm Jesse Mercury, the creator of this podcast, with support from Trisha Schmidt and Casey McKenzie. Artwork by Egg Salad Salad. Our theme music is the song Time Machine from my synth-pop album Sci-Fi, now streaming everywhere. Join our community on social media, TikTok, Instagram, YouTube, and Facebook, all at Major Pain Podcast. If you have questions or comments you'd like to share with myself, our guests, or our listeners, send an email to majorpainpodcast@gmail.com. You can also head to our website to learn more about this show, support its creation, or leave a comment on any episode at majorpainpodcast.com. Major Pain is supported by our listeners on Patreon. Thank you to our $2 per month supporters, our $7 per month patrons Naomi Adele Smith, Sonny Roberts, Kelsey Matson, Alexandria Henderson, Justin Minnick, Heather Muncie, and Robert, and our $25 per month producers Steve Kavanaugh, Chris Fowler, Trish O'Brien, and Hipster Leia. Learn how you can support this podcast while receiving special recognition on the show, gifts, and monthly bonus episodes at patreon.com/majorpainpodcasts.